I mean, that's the model we espouse. That's, what I've done in terms of how I got
Yes.
to where I am in terms of building that. There are things I love to do. I determined I really loved and passionate about orthodontics, and certain things. But, having done that, yes, lots of implants. At the end of the day, I have a surgeon comes in, I treatment plan those and that's the thing. You don't have to do everything. You don't have to micromanage every treatment. You can be the quarterback and manage a team that delivers, a really high quality, high level of dentistry that's going to give your patients superior outcomes, happy patients that ultimately will grow your practice.
No, it is. And looking into things that call your attention, right? For the new grads out there, like what are things that you're reading that call your attention? Might be, I remember when I'm taking my kids to time to get into college, university, and they're looking into these tests that you have to take, aptitude test, and that was your merging skills, right? And they kept saying, like, pay attention to merging skills. Then after is your second occupation. Right. Then you waited to school for one thing, and then I really don't like it.
And you end up somewhere else.
Someone else, because it's your emerging skills. And I think we have that in our practices, right? And into our everyday dentistry. For me, that was myofunction. Myofunction got me. It was something that I was curious about and became part of my everyday living and breathing. Like I monitor everyone's how you speak, how you walk. Like I check people's necks in the grocery store. Oh, that one has airway problem. So also looking into that, things that cause your attention. I'll be curious, and go further into your education, even in things that you may think is not so directly connected to your everyday clinical chairside application.
Yeah, and that's what it is, right? It's about keeping an open mind and letting yourself be uncomfortable.
Mm-hmm. You know what I'm taking now? You don't know that yet.
What?
I'm taking an ADHD coaching course. I want to learn how to treat patients better, patients who have anxiety and things. So keep it pushing yourself. Like it's so important.
We're more than just drillers and fillers. I mean, and that's kind of what it is. Dentistry is not that anymore. No. That was 30, 40 years ago. It is not now. And I mean, even for me, because ultimately, working together, that was where, myofunction. If you would have asked me 5 years ago, I would have been like a lot of the orthodontic establishment, which doesn't place a lot of,
not enough attention to it.
Not enough attention, but don't even really believe in its role in terms of what we do. And yet, I allowed myself to be open to it. And it's why now it's such a big part of what we're offering at DMG and Connected Health especially, which is the idea that, I've seen so many cases come back, and I've always come from that philosophy, we're going to put the teeth in the right place, and then we're going to put retainers in, and they'll stay there that forever. And then I start looking back, and I start looking at all the adult patients I've done, and looking at how many of them are having orthodontics done for a second or third time. And then, we look at the same problems. Why is the recrowding there? Why is the arch constriction there? And then you take a look at them and you see, wow, they've got a tongue habit. They've got low tongue. And you ask them, do they snore? Do they breathe? They're on CPAPs. They're on all these airway issues. And then we go back to the kids. We start assessing the kids. We start realizing, oh my God. And there's, was a study done by Dr. Derek Mahoney out of Australia, a famous orthodontist, who showed that between the ages of 7 and 9, he had a sample size over 3,000 children, 90+% had some form of sleep disordered breathing associated with malocclusion. So why are we not addressing this and creating healthier patients long-term? CPAP is the gold standard for sure. And we work on airway, and we make snoring appliances and do all those things. And those are great. And those are a great service for our patients. But at the end of the day,
they're Band-Aids.
They're Band-Aids.